Tuberculosis. We're going to tackle the risk factors of tuberculosis, signs and symptoms, and treatment. Tuberculosis is a bacterial infection in the lungs. It's spread by airborne droplets with coughing, sneezing, speaking, singing, or laughing. So just by nearby a TB patient, you can get infected with the TB bacteria. Risk factors: close contact, inhalation of bacteria when in close contact with a person with TB, low immunity. If the immune system is low, you are more open to getting infected, especially if you spend time with a person with TB. Substance abuse, delayed medication. Patients who abuse substances are less likely to be screened for treatment since the anti-tuberculosis medications are usually metabolized by the liver, which is often damaged by substance abuse. Inadequate healthcare. Since TB is common in developing countries, healthcare facilities have inadequate infection control, poor ventilation, and air circulation. Immigration. Migrants may have a higher risk of becoming infected or developing the tuberculosis depending on the TB incidents in their country, the conditions experienced during their travel, and their living and working conditions in the country of immigration. Overcrowding is more common in countries where many people live in absolute poverty because people are more likely to live and work in poor ventilated and overcrowded conditions. Signs and symptoms: tiredness, loss of appetite, weight loss, fever, night sweats, cough, and sputum production increase over time. Sputum may contain blood, and chest pain. Treatments: promoting airway clearance. How do you promote airway clearance? It's by using the standard therapy. If standard therapy do not work, then mechanical devices may be indicated. Examples are the mechanical precursors and the positive expiratory pressure, or the PEP. Adherence to the treatment regimen, anti-TB medications. So there are many challenges in following the treatment. The duration of treatment is very long. The combination therapy is required and side effects may be unpleasant. The cost of the medication, and also patients often experience rapid improvement, so they tend to mistakenly think that they are already cured when they're not. Promoting activity and adequate nutrition. So, malnutrition can lead to secondary immunodeficiency that increases the host susceptibility to infection. So, adequate nutrition is very important. Preventing the spread of tuberculosis infection. So, how do we prevent TB from spreading? The patient should take all prescribed medication. They should cover the mouth when sneezing or coughing and always wash their hands and isolate themselves until the TB is cleared. Acid fast bacillus isolation. Acid fast bacillus is a smear examination that is collected in 3 different days. If the patient is under an effective therapy and is improving well, and the results or the acid fast bacillus turned out negative in 3 consecutive tests, then he or she can be out from the isolation. Disposal. The disposal of the sputum of a TB diagnosed patient is one practice to follow to avoid transmission. Monitor adverse effects. When giving treatment to TB patient, It's very important to train or educate about the adverse effects of the medication. This way, the patients can easily recognize it and inform the healthcare provider.